Well, welcome to another Cutting Edge show. I'm Omar Neal, one of the hosts of this show. I'm the former mayor of Tuskegee, Alabama, and host of the You Got the Power syndicated radio talk show. You are tuned in to the Cutting Edge, where we discuss all things health and wellness, COVID-19, and beyond. This program is being brought to you in part by the University of Maryland School of Public Health. And believe it or not, we got our friend back on the set. I'm talking about somebody that has embraced what we've done from almost the beginning. He has been an integral part of the evolution of the Cutting Edge. His name is Dr. Michael Osterholm. He's an epidemiologist and director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Today, we're going to discuss this issue called racism. Racism declared a public health issue. What race got to do with it? And so we're going to have a really in-depth conversation about the notion of race as it impacts health disparities and what can be done, not just to restate the problem, but really get into an in-depth conversation about what we can do practically to mitigate against the structural racism that we have in our country. I got this guy called Dr. T. His name is Dr. Stephen B. Thomas. He is the professor of the University of Maryland School of Public Health and director of the Maryland Center for Health Equity. He's the co-host of The Cutting Edge. We have been doing this for over 100 shows now. And it has been an incredible ride. This is the last show. This is the finale show of the year. And so we are excited to just exhale and to say, you know, we're so happy we had the opportunity to bring information into the barbershop, into the hair salon, and to the different social media platforms, believing that when people get the proper information, they naturally gravitate to take care of themselves. So, ladies and gentlemen, please join me in welcoming a brother from another mother. I'm talking about Dr. T, Dr. Stephen B. Thomas. Hey, Dr. T, how you doing, man?
Well, it's always good to be with you, Mayor. And I can tell you that we're at a whole new stage in this pandemic. So I came representing the ancestors. And I think Harriet Tubman is the metaphor for us right now. Mm-hmm. People have come out of their bubbles. Mm-hmm. Things look okay, mm-hmm. but there's still darkness. There's light, but there's still darkness. And people need to know which way to turn. Do I put on a mask? Do I not put on a mask? Mm-hmm. And now just putting on the mask says so much more than simply I'm protecting myself. It also says something politically. When did that happen? So we're in a very interesting moment. Why these shows are so important. So it's good to be here with you, Mayor. And what a show we have tonight to have Big Mike joining us.
Join us, man. I mean, we enjoy having him, man. He's really so down to earth and just family. When Dr. Michael Osterholm come on, we just have a family reunion. So that's what this is about. Dr. T, the people behind the scene oftentimes are not touted like we do. I mean, because we really appreciate and understand how critical what they do is to the success of this show, right? Mm-hmm, mm-hmm. I know that you want to say something personal. Yeah, I'm always the one that is introducing them and all of that. I want to give you an opportunity, Dr. T, to say something personal about our team behind the scene.
Well, I was thinking to myself, where we began, Mayor, they were students. It's amazing to see the growth that has happened and thrust on the front line of the pandemic and having to problem solve as a team. Amazing.
Mm.
So, and everyone now knows about Meg Jordan and her public health moments, her public health minutes, and the surprises we get sometimes. And the social media is picking up. Hey, Soraya, what an amazing job she's been doing on our social media work. And we have somebody that doesn't like to come from behind the curtain all the time, and that's Maggie Daly, our assistant technical director. But let me say something about Maggie. She just got accepted to medical school. Let's give her some
Some
snaps.
snaps,
There we go.
absolutely. You know,
She's all acting all shy back there.
yeah,
And you've introduced me to Elijah Pugh. And let me tell you something. Every time that soundtrack comes on,
yeah,
everybody starts tapping their foot.
yeah. You're right, man.
So
It's
I think
incredible.
I would just simply say when we talk about young people and the young adults coming up, they give me hope, and I think they're not alone.
Yeah. Well, I say kudos to our team behind the scenes. They are incredible. Love them to the moon and back. And so, man, we're lucky to have them with us on this team, on this journey together, right?
Here we go. Here we go. Buckle your seatbelts.
Buckle your seatbelt. Make sure you can connect to us in many different ways. Make sure that you check us out on Facebook, YouTube, Instagram, and Twitter. And we have some more areas, Twix and Turns and all of the other things, man. They got everything going on with us. And so make sure that you like, subscribe, and share. Because each time we come on the air, we are here to be intentional about sharing information that you can use, practical information to take care of yourself and your families. And so make sure that you do that. Also, subscribe to our newsletter. It comes out each and every week, even the weeks that we're not on. Our newsletter comes out, and it encapsulates all of what we've done in the previous weeks. It gives you the previous shows and snapshots, snippets of vignettes, if you will, of previous guests, so that you can get the essence of what they say. And that's curated by the team behind the scene, and they edit that out into a really nice piece. So we are so happy about that. So make sure that you like and subscribe and share our newsletter as well. All right, Dr. T, before we do anything, do you know you were at the White House, remember?
You know
ago, right?
You know what the barber said when I walked in? They
What?
said, "We saw you at the white man's house." That's what the barber said.
And that man,
but they were so proud.
They
were
put
so
you on
proud.
Front Street, though.
They sure did. They told me, they gave me, they were just simply glad I brought their joy in that room and did my best to represent.
Well, we had President Obama there for 8 years, so we can't really say that's all that now.
It's a start.
It's a start. But anyway, Dr. Rochelle Walensky said in that gathering that
Yes.
CDC had declared racism a serious public health threat. And I want you to hear what she said. Take a listen.
Thank you so much. It's so good to see so many friends. Thank you for joining us today and for your interest and action in advancing equity in public health and truly during the COVID-19 response. You may remember in April of 2021, having served on the front lines, having seen how racial and ethnic issues affect so many infectious diseases, I declared racism a serious public health threat 2 months after arriving to CDC. Our agency and public health made a commitment to address racism as a fundamental driver of health disparities. We sharpened our focus on equity and on longstanding systemic health inequities, and there have been many actions over the last 19 months. In addition to some public health departments that predated us, we've had over 200 public health departments join us in declaring racism a serious public health threat. We were recognizing, of course, at the time, as I know all of you have, that certain groups were at increased risk of COVID-19 illness and death. This, of course, included racial and ethnic minority populations, people living in rural and frontier settings, people experiencing homelessness, people.
You know, Mayor, one
Mhm.
of the things that, as we open up, is you'll find this tendency to want to recite the problem to the point where there's no oxygen left in the room, to do anything about it.
Mhm.
Having been in that room, let me just say, when she walked in the room, there's a certain presence, and it was there. Okay, she carries that sense of authority. But I wish that room would have just applauded when she said that. To me, that's the applause line.
Right.
But that's
Right.
me. That's
Right.
me. But
Right.
one day we would get there to, number one, acknowledge that's a bold statement. Let's take it seriously and what it would mean. Applaud it. But it's also validation from all the data that we have over the past 50 plus years. The pandemic put a microscope on it. We have a window. It won't be open forever to have fundamental change based on that very premise of racism as a fundamental issue.
That's true. At the same time, and as we have our discussions, people say, so what now what? Right?
Okay.
We always knew racism was a public health threat. It's not a new thing for us, right? Right? So now what can we do practically? And I think that's where, we need to have the conversation about what do we do to dislodge the structural racism and the institutional racism that exists within the public health system. And that's the work that we have to do.
Yeah.
And again, to acknowledge it is the first step in solving the problem.
Okay.
So I agree with you.
Okay.
And
now,
that it should be applause line.
there we go.
Let me agree with you.
And let me
All
say
right.
this before we bring our guest up, is that
Right.
remember when we had our legislator here, Jocelyn Pena Melnick, we asked her the question of
Right.
how important data versus stories. She says you must have the data, but you can't get it over the finish line without the stories. We're going to hear something about that data that may help us match the stories we're hearing in the barbershops to move the needle. I hope so.
Yeah. Well, to have this conversation with someone who has such a broad understanding of public health I couldn't think of a better person to bring on. Not only is he one of the gurus in the space of epidemiology, but he's an humble person, man. He's very humble, right? Right. He said that about learning, that the older he gets, the more subject he is to learning. Susceptible he is to learning. Let's bring up our dear friend, Dr. Michael Osterholm.
Snap him up, bring him on up.
Absolutely. Good. Dr. Michael Osterholm is an epidemiologist and director of the Center for Infectious Disease Research and Policy at the University of Minnesota. And, he was one of the top people for the White House as it relates to COVID-19 and the whole initiative to get people vaccinated, the uptake of COVID-19. He was a part of that team for the Biden administration. He is one of the people, the go-to
There you go.
when it comes to understanding the issue of epidemiology and diseases. And so we're going to talk not just about where we are today. We're going to talk about where we could be going tomorrow and what do we need to do to make sure we protect ourselves for the inevitable that could very well take place. And so, ladies and gentlemen, please join me in welcoming our brother back to the stage. We call him Big Mike here, Dr. Michael Osterholm. How you doing, man?
Hey, thank you so very, very much for having me again. It's a real honor. I thought maybe I'd borne out my welcome with you, but I'm so honored that I haven't. I do have to set one thing straight, though, here, that I never fail to remember that when I'm on the screen, there's really the number one Mike is sitting there on the screen, Mike Brown. Michael Brown will always be the number one Michael. I'll always be after him, man. I learned from him. So
Yeah,
good to see you, Michael Brown.
You better get it right. Dynamite.
Dynamite.
Dynamite. Wow.
There you go.
There you go. So,
man,
anyway,
it's so good to see you. How you feel, man? How things going? Everything's going good?
Yeah, good. I'm hanging right in there. I wish the bugs would slow down a little bit, but they keep coming at us like a 210 mile an hour curveball.
Right.
And I know we're going to be talking about that tonight, but it's just great to be with all of you. And, one of the things I think that I just have to say as an observation right from the start here, what makes this group so special is not just what you do, but your perseverance in doing it day after day after day after day. And you know what? That is a real gift to the community, because as we know, changing public health, changing the public is not something that's done overnight. And so when I come on here, I'm reminded of that. And it basically is uplifting to me to say, yep, you got to stay in the ring. You got to keep at it. This is what's important. So thank you so much. And it's always good to see you, Mr. Mayor. I just wish you were mayor of every city in the country right now.
Big Mike, that indeed was a message to the White House. Don't abandon us on the front lines.
Right.
And I think that message got through loud and clear. We just need to know how to translate it into action, as the mayor's describing. But I just want to point out that in the very early days of this show, that's now we call the Cutting Edge, you were there with us.
Right.
Remember?
Right. Absolutely.
And so I hope you liked how we were able to bring that clip of CDC Director Walensky.
Loved it.
Because one day we'll have the technical capability to bring you back. You said these barbershop programs should be all over the country. That's
Right.
what you said.
Still believe it. Absolutely believe it. And one of the things I think that was somewhat missing at the White House meeting, at least as I understood it, I wasn't there. There was not enough of an understanding of how critical it is. This is a 50-50 back and forth. If we're going to lead in this country, we got to listen to the people that are on the front lines. We got to understand what it is they need. What do they want? What are they hearing from the public that will help them do their job better? And I think that that's such a key piece. You are all about community intelligence, and you're the one that can say, that's not going to work here. This is going to work here. And so I think that it's not just a recognition of you're out there and how important it is, but it's also, oh my, are you not but the most important source of frontline information on how to make something work? And that's all we care about, is making it work.
Absolutely.
We are at this stage where people have become comfortable, in this kind of sense of normatization is setting in. The public health mitigation measures have been relaxed in the cities and states around the country, but we still have a looming issue with COVID. I want you to kind of help understand where we are today, if you could put it in a capsule, Dr. Ostone.
Yeah. Well, let me just be really clear that we're not done with this virus. It still is in the driver's seat. Just in the past 2 to 3 weeks, we've seen a substantial increase in cases. Deaths have increased by 60%. We're now going back to numbers we hadn't seen since last spring. And it's that basically people are, number one, not availing themselves to the bivalent booster dose. Got to get that booster dose. Doesn't necessarily stop you from getting infected, but it surely can do a lot to protect you from serious illness, hospitalizations, and deaths. And only about 22% of the U.S. population that's eligible for the vaccine, particularly among those who are older, have gotten it. And so here's a simple thing. Number two is just remember that for those who are particularly 65 years of age and older, there's no magic number where it just is a direct cutoff, that we have to do everything we can to help protect that population, because right now about 80% of the deaths are occurring in that group. And many of these are not frail elderly. They're viable, very healthy elderly, otherwise, as we use that term. And it is truly a total loss to everyone for them to die from COVID. And so I think we want to keep pushing this issue. The other thing I will just have to say is there's so much that we can do to help ourselves by just the respiratory protection we talk about, and how if we're going to be in big public settings, particularly if you're someone at risk, how using your N95 respirator can play such a key role in reducing transmission, but also how to live your life, continue to move on. We can't just live in fear in a corner. Our group has adopted a new policy, and they jokingly call it the Osterholm protocol. I'm not sure I want it associated with me, but it's one where if we're going to have a big get together, which we just had, our group just had one last week. Number one is you can't be in contact with anyone who is known or suspected of having COVID in the past 3 days. Number two, if you have any symptoms, even just a runny nose, suggestive of an allergy, can't come. And number three, you need to test within 4 hours of coming. And you know what? We've had some wonderful social events where we've felt very comfortable and confident that we were not putting anybody at risk. And so I think there's also a lot of messaging we can do to get that out there. But the last piece I want to add, and this is where I think we all are challenged. We all know that this disease has been much more of a divider than a bringer together, at least among so many communities. And that has not changed. And if anything, I worry it's hardened some. And so to me, that has to be job one yet. Health equity, racial equity is not just about one disease, but there is one disease facing us straight in the face right now that continues to challenge us, and we can't give up or give in. I think this is an important message. So I think the White House meeting was really important, and I was so honored that you were there, Dr. T. And we're able to represent this very important effort. But at the same time, that's not enough. We know that, and you know that, and that's why we have things like this very special program here. So we got to stay the course. We got to stay the course. I want to grow old with you guys together, and one day when we get old, we'll say to ourselves, "Hey, let's have a party. We did it. Okay, let's have a party. We did it."
I think about practical things all the time, Dr. Osterholm, and that is,
please, Mike. Remember, Mayor, it's Mike.
Okay.
My daughter's Dr. Osterholm. She's she's a neonatologist. Okay.
He's in the barbershop.
Yeah, there you go.
Right, Mike. Let me say this. Just something we talked about it on the show all the time. Concepts like let's boost the booster. Let's have campaigns about boosting and the importance of getting the boosters. Right. I think we kind of spiked the ball before we finished went over the finish line, and we spiked the ball on the 20-yard line or something like that. And we are not talking about, like, everything you said makes all the sense in the world, Mike, but we are not talking about it enough. So right. What do we need to do? Tell me.
Well,
I
think
sense
yeah,
go ahead.
No, go ahead. If you finish, please. So.
No, I'm just saying it just makes sense that we out of sight, out of mind. That's all I'm saying.
Well, I think one of the things we have to do, and you noted this, and I think it's probably one of the most important lessons I've learned in this entire experience. It's not being about the best, the brightest, and the smartest. I see a lot of people like that, but if they can't communicate, it does nothing. And today, one of the things for us to really communicate on a day-to-day, hour-by-hour basis is you got to have a lot of humility, because you know what, this virus continues to throw curveballs at us that if I were to tell you X, Y, and Z today, and it's not X, Y, and Z tomorrow, what credibility do I have? And so I think early on when the vaccines were first developed and the first testing of those vaccines came out, there was a certain sense of euphoria, like, walloo, 2 doses and we're home. And like measles vaccine, there's a viral infection. If you get your 2 doses, you're probably protected for life. Well, this is more like a flu vaccine now, where we say, you know what, you're probably going to need to get a booster every 6 months, and it's not going to protect you from necessarily getting infected, and it's not going to necessarily protect you from transmitting the virus. But guess what? It'll keep you out of the hospital. You won't get severely ill, and you're much, much, much less likely to die. As I've said time and time again, if COVID became a common cold and I got it twice a year, so what? But if COVID is going to put me at risk of dying, that's a big deal. So I think one of the things we have to do is we have to be just honest with our constituents, our friends, the people we work with, to say, this is what we know. This is what we're learning. And I'm making the case right now that when this new bivalent vaccine came out, there was a sense, oh boy, this is going to last for a long time. I think we may get 6 to 8 months out of this, even with superior protection against hospitalization, we may be boosting a bit. And you can't go to that place and have people believe you if you left them with the fact, I know everything about this and this is what the facts are, and then it changes.
Right.
And I think that's where science needs to have that sense of humility. We just got to have it.
Well, humility and
line,
honesty too, and which is humility, I think too. Go ahead, Dr. T.
Yeah, we overcame so many barriers to transform barbershops and salons into COVID vaccine clinics. Amazing. And we built a lot of trust and trustworthiness. And so people are actually coming into the shop, Big Mike. Can I get my booster? And while I'm here, can I get the flu shot? And we've had to say no, because our clinical partners have dismantled the temporary bridge. And so we are staying the course in other ways, like making sure people have KN95 masks, test kits. That's another very important thing. We're kind of on our own to save ourselves. And we do need to know at the individual level what we can do, because, Mayor, there are people talking about it. Every now and then my channel flips to a certain station, and it's constant. And it's a constant undermining of our institution. So we have to have a place where we're having this conversation and that people are getting the right information, especially in the minority communities.
Well, one is that we talked about disinformation and misinformation that was being disseminated. And so you have to counter that with correct information. If not, then the prevailing thought will be the mis and disinformation. And so that's why I say it's so important that we keep talking about it. And I know people are tired. It's like Fannie Lou Hamer. I'm sick and tired. I'm sick and tired, right? And I understand, people are weary in well-doing. But what we are talking about now is a matter of life and death. And I think we can look at it like Mike says, it's kind of like the flu. People get annual flu shots, so they get periodic flu shots. And so this has become kind of endemic, right? And that we will probably have to live with this. And is that what I'm hearing you say, Mike?
Yeah, and again, I'll even go so far as to say I'm prepared that there may be changes in the future that even changes that. But the bottom line is I will be honest and tell the public what I know, how I know it, what's happening. Why are these cases suddenly starting to increase now? What's happening here? How big might the case numbers get? I don't know. And I think that one of the challenges you have when fighting a virus like this is the unknown often is perceived as you're not telling the truth, is somehow you're hiding something. And what we need to do is help people in this journey with us. You know what I know. I know what you know. Let's do it together. And I think that goes without regard to age, gender, race, etc. We got to figure out how to build that coalition of the willing. We're able to say, we're going to go through this journey together. And if something changes in the next 2 months, we'll all know why it did. I mean, in the sense that we can document the case numbers are changing or what's happening. That, I think, is what we've missed. We've had too many people who have been authoritative figures that have lectured down to us and have not heard us, okay? And I got to tell you right now, I'd rather have 100 preachers all out in the pews out there talking to each other than a one big one up front into the pulpit, okay? And I think that would be really good.
Well, you'll be pleased to know that there are wellness warriors out there. That's what they call themselves, wellness warriors.
Yeah.
And Mayor, this might be a good time to get a pulse beat to actually find out what people are feeling out there.
Well, why don't we tee it up, Dr. T?
So I want you to think of a word that best reflects how you're feeling right now at this moment in the pandemic. And it is still a pandemic. And drop that word in the chat, and our team behind the scenes will build a cloud. And now keep putting the words in. Don't worry about spelling, just drop it in. Those of you in social media, use the Q&A box. And for another 60 seconds, we'll just keep dropping those words in.
Yeah.
And go ahead, Mayor.
No, I was just thinking about, and we were talking about, we were going to get all of the word clouds over the year.
Yes.
Right. And what if we were to put them all together and see how that comes out? Wow.
Well, you should know that after our shows, I post the cloud in various places, including sending them to Mike and letting him know, even in the height of the pandemic, there was energy and optimism coming off of the clouds with this group, and that's the engine driving us forward.
Yeah. Big Mike, I want to talk a little bit about, stress and depression and all of the other things that come from the isolation of pandemic, and how does that impact, public health?
Yeah, I think it's really important to understand that we're more or less experiencing a Category 5 hurricane, a tsunami, a terrible earthquake, one heck of a volcano. And oh, by the way, did I throw in a blizzard? And I think that any one of them could be challenging. But, if you look at society today, look at what we're dealing with the hatred from some groups. That has nothing to do about COVID, but it has a lot to do with factors that ultimately one day are tied to COVID in a sense. And so I think the challenge I have right now is, where are we going in society? I must tell you, I was frightened to death of our last elections. And I thought, oh my gosh, is this going to be the end of our country as we know it? What will happen? Will people pick up guns and go and change elections? There was a part of me that felt so proud of this country for what we did in the last election in a meaningful way. But to think about this, in all of my years, I'm 70 years old, I never once thought that this country was going to go down because of what we had seen over the past, we'd seen over the past 2 years. So now I overlay that with COVID. I overlay that with racial inequalities, with the disparity of income, all these things. And I say to myself, wow, this is uncharted territory.
Yes.
And so I think one of the things we have to do is never give up. You can't give up. Number two, though, is be open to understanding what's happening in these uncharted territories. And what is it? What do we need? What do we mean? What do we have to do? And, I have to say, I think we have to reach out. Now, I have to look at this group here, and, I have been blessed, simply blessed, because you know what? I've been around the business a long time. I've been a lot of places. I've met a lot of people. But as they say in the movies, I ain't never met nobody like Dr. T. Okay, I ain't. Okay, I just haven't. Okay. And, I've learned more from you, Dr. T, about the issues at hand, things that I thought I knew and I didn't know. So I think one of the things I'd say about right now is that we have to find ways to build these bridges. How do we do that so that we can share information, so that we can share, the ideas and what we need and don't need. And so to me, that's where I'm at right now, is building bridges at a very difficult time with an uncharted territory kind of situation with this pandemic, but not giving up. By gosh, if this country gets through this last election, we're going to get through. Okay, we got to do it.
I got Georgia on my mind.
There you go. There you go.
Well, Georgia came through for us again. All right. Let's see what the people are thinking. The collective feelings of the people. Let me see what comes up. Bam! You see what happens up there? Hopeful, right? Blessed, encouraged, right? Understanding, honored, excited, grateful, uncertain, impact, determined, thankful, concerned, challenged, motivated, proactive, pain, people, empowered, fired, confused, but inspired as well. But if you notice, the larger the word, the more people said it.
That's right.
And if you look at just the words in the center, where people adapt to hopefulness because they're blessed, and encouraged because they're united.
There you go. Now keep the cloud up there for a moment. Big Mike, I thought you were right on time about the danger and the opportunity of kind of validating our values. And so this group has had this kind of hope throughout the pandemic. This is a pathway forward. Yeah, I got the Harriet Tubman on to guide the way, because we have to keep hope along the way, because the politicalization is getting really intense.
Yes, it's really intense already, and Mike, you articulated very well. And there's a lot of despair, a lot of uncertainty about where this country is going. The last book, Mike, that Dr. King wrote was entitled "Where Do We Go From Here? Chaos or Community?" Right, and I think that's the salient point for where we are today. I mean, because we're going to get out of this unless we unite. And I saw the word unite because that's true.
Yeah.
There was something about violence. He said we will ever learn to live together as brothers, or we will perish together as fools.
You know, if I could add, in the discussions that led up to the election, I had with several close friends and family members about what my thoughts were that might happen. And frankly, I was very concerned, as I just noted, about what might happen. But I said, at the same time, I have to be hopeful. And I sent them all copies of Reverend King's I Have a Dream speech. And I said,
Wow.
just read this again, okay? This is what we gotta go with. This is what we gotta have a dream here. And, you know, I gotta tell you, I think those words meant more to me then, just recently, than it ever has in any time in my life. And I think that's part of what this is about. This operation, this organization, this effort is, man, you guys have a dream. And we can't let anything get in the way of that, no matter how difficult. We got to find a way to get over it, under it, around it, or through it. But we're going to get around it.
Right. And we don't just go through it, let us grow through it.
There
And
we go.
We're better.
There you go. There
on
you
the
go.
other side of it. Right. Let me bring up, since you talk about Big Mike and Dynamite Mike and you know the new president, you know. Oh man. We have so much fun with Dynamite Mike. Hey man, how you doing?
Hey
Unmute.
man, how you doing?
I'm doing
And
great.
Hey, Dr. Osahom, how you
I
doing?
got my two
Good,
mics
man.
up on the screen.
Can
man.
I just tell you, if you want to know the pecking order, if I'm in his shop, he's doing the haircut and I'm the sweeper with the broom. That's my job, man.
Oh,
But I'm good at it. I'm really good at it.
I love that.
I know how to sweep, man. I know how to sweep.
You know, Mike, you know, we're embarking upon a conversation that's real difficult for a lot of people to have. And people have shunned, you know, really getting to honest dialogue about the issue of race. And we go into our respective corners and we kind of live in these silos, you know, and you know, this kind of confirmation bias where we just kind of be around people who just think like us, right? This is the kind of conversation we need to have, right? What kind of conversations are happening in the barbershops concerning the issue of race as you see it?
It's definitely an outcry of the injustice that's going on, and everybody does a lot of finger pointing. It's hard to control the narrative because there's so many opinions coming in and so many different angles with people having their own reasons why they feel this way, probably because of personal trauma they've been through, and they've just formulated a thought pattern that it just doesn't help with how things should be handled. Most of the time they want to get like January 6th. They talk like that. Then you get people who just don't care at all, you know, and we need to get them involved because we need their vote. So just trying to stay neutral to fit the shape of the container to get the message across is kind of difficult because you get carried emotionally away sometimes with the different angles that they come with. So just for me, staying neutral and just trying to deliver correct information is how I can try to change the narrative.
You know, Mayor and Big Mike, Dynamite has done a wonderful job in giving us metaphors that work in the community. Take the shape of the vessel. Say that again, Mike.
You have to fit the shape of the container. Most of the time you turn in the water.
Right.
You have to fit the shape of the container.
You know,
So you have to resonate to some degree when that person who wants to get angry and, you know, get all January 6th on you take some of that on as well.
right. You know, one thing is, as he talked about it, think about air and water,
Okay.
two of the most powerful elements known to man. Both of them take the shape of their container. Right? So your power is in your ability to adapt, to be in present, to be in the moment, right? That's what connects to people. And if you noticed what Mike said, dynamite, I have to make the distinction. What he said was that he's non-judgmental. on
That's
this,
right.
right? I can understand your trauma because your lived experience trump anything else I say, right? Right. And that's what, and I think when we come to a place where when people are being honest and authentic based on what they experience, then we say, okay, I can understand why you feel that way. Right. Right. And then now we can have a conversation on what we can do, because I think as African-American people, I'm speaking specifically to African-American people. And this is something that Rosa Parks told me when I was asking why did they boycott the buses? And I said, was it to eventually break the buses? She said, oh, no, that ain't why. And then I thought it was a rhetorical question. So I said, well, why? First step in any liberal process is that press must withdraw their participation from their own degradation. You know, there's something that no one else can do for us but us, right? So we need to get the information about COVID. We need to take care of ourselves and our family. That's not something anyone else can do for us. But we understand that it's about trust too.
Yes.
Right. And it's not, and Big Mike told me this before. It's not just, you know, the message, it's also the messenger.
That's right.
Right. And if we don't have the right messenger, then the message will be lost. And that's why, you know, you are a wonderful messenger, Dynamite.
Yep.
Got it.
Yeah.
Thank you, guys.
You're a wonderful messenger. Stay with us. Let me bring up Dr. Sharon Cooper, and let's go to her, and then you tee up Sandra Jenkins, and we'll bring up Michelle, and I gotta get to the public health minute too. So
yeah, and Big Mike, we got some new people for you to meet.
Yeah, this is Dr. Sharon Cooper. Dr. Cooper, how are you doing this evening?
All is well, all is well. Feeling empowered.
Absolutely. It's so good to see you. Tell our audience a little bit about you for those who are new to the Cutting Edge Show, and then talk a little bit about how do you see solutions to deal with disparity. You out there working with it every day.
Oh, absolutely. I'm Sharon Gibbs Cooper. I'm with University of Maryland Institute for Governmental Service and Research, and I work with diversion programs and behavioral health treatment programs. And what I do, and just to add to that, Dr. Thomas has served and currently serves as my mentor. And I've had the privilege of working with him and Mayor Neal and Mike, Katrina, and all the others in just helping to inform practices and policies. And what I love about being a part of this initiative is this: not only we talk about all these things that are going on, but we're looking to move that needle, changing that narrative. We're making it inclusive, involving not only the people who are in the communities, but we, like Dr. T mentioned, we have legislators who join in.
Mm-hmm.
We have, we have healthcare providers who reach out to Dr. T in this program because they see the value that it brings into the communities, meaning this is the voice, and it goes both ways through these efforts. This is the lens, the voice of those who are in the community. So it helps those providers to understand why there are so many gaps in outcomes, services, and access. So it's fruitful. I mean, it's very important that we continue these efforts. And as we talked about today, we know about politics and the role in policy and how policy is basically going to be shaped by information being given to those policymakers. And as Dr. T alluded to earlier, we talked about data, and I worked with data for 21 years. And I always tell folks, especially in these diversion programs.
And when you say diversion programs, I want to put it where the cows can get it. So,
they're alternative, basically punishment without bars. Looking at the entire person and all those elements which are contributory to individuals using substances and those individuals who are engaged in criminal activity. And so when you understand the root causes, then you can look for solutions. And as with this initiative, it is comprehensive in scope. That means you have to tackle all those problems. Otherwise, you look at recidivism, that same process repeating over and over again, being arrested for the same crimes. So if it's drug related, or if it's what we call employment related, there's special courts like that in Baltimore based upon the evidence data provided through the social unrest. So the data tells a story, but without that story, with people being behind to convey that message and understand and feel the oppression that folks have, then it's meaningless. So that's why, again, I repeat, efforts like this, initiatives are so important. Those forums that are being held like today, very informative, because it conveys a message that a lot of people are not exposed to because of where they are, where they work, where they live. And that's, again, the value of these particular programs that are spearheaded by you, Dr. T, Mayor Neal, Dr. Osterholm, and the other people who are what I call our change agents in the community that are all instrumental. So I'm going to shut my mouth because I talk a lot.
No.
And when I speak with the judges and I speak with state attorneys, you have to part of that whole picture is being able for them to be able to understand who they're working with in that context.
Right.
Well, we're getting some flowers at the end of the year. I just love the way you're encapsulating the experience. We don't always have the bandwidth to have the conversation. She was on your webinar earlier today, Big Mike, and so our group is also tuned in to information that helps them make decisions, and can disseminate that through the network.
What and you're correct, Dr. T, but what Dynamite was saying is it's not just the COVID, it's the other stuff that Dr. Cooper is talking about that complicate people trusting and engaging in self-care concerning COVID.
That's right.
And so we can't just isolate them. We have to look at them in a holistic way. And so we got to deal with all of those things. So Dr. Cooper, you really put it where the cows can get it. I appreciate you. Thank you so much. Let's bring up Sandra Jenkins, and then I'm gonna take a break and bring Meg up, and then I'm gonna go and bring my wellness warriors up after that. Hey, Sandra Jenkins, how are you doing today?
I'm doing pretty good, Mayor Neal.
How things up in now? No, it's right outside of Philadelphia. Now, I'm always saying Philadelphia. I want you to tell people exactly where you are so we can give them some props, and you can give you some props exactly where it is.
Okay, I'm located in Cheltenham Township, Pennsylvania. A part of Cheltenham, it's Glenside. It's Old Glenside. It's a very historic community. We have several businesses that are happening there. It's such a very diverse community, and that's Glenside. I've been a part of the Glenside community for nearly 29 years, so it's home for me.
Good. So, because I want to give you proper props. I'm saying Philadelphia. They want to make sure that we focus on exactly where you are and the shop that you own.
That's right, the shop.
Yes, and the salon that we own. I'm in partnership with someone else. She is also a staple of the community. And we're coming together right now to really create this public health approach within our salon as we speak. So I'm very, very happy to be working in unison with the community, other salon professionals in our community to really, really incorporate the importance of public health within our salons.
In the name of your salon?
So the name of our salon is Naturalist.
There we
Everybody
go.
knows Naturalist. Naturalist is a staple of the community, and I'm very proud to announce that. So we are in the midst of right now of coming up with these ideas and brainstorming and how we're going to implement this. But this is a wonderful discussion topic, because as I'm listening to everyone here, I'm thinking about incorporating or having a book signing in my book in my salon, and that is one book that I've have been reading and also have gotten to meet and to know the author. And the name of the book is White Fragility: Why Understanding Racism Can Be So Hard for White People. So really trying to incorporate those discussion topics in our salon, because everyone knows that Sandra Jenkins hates racism. I cannot stand it. I cannot stand it. I have to say that, first and foremost, because the fact that it really not just hurts Black people, but it hurts white people as well. It's a shame that you will actually feel like you are superior when you have deficits in your life. If you never lived or engaged with people that had something, different than you or something more to share, then that's not a good thing. That's not how you want to raise your children. So these are the discussion topics that we have within our salon. And I feel very confident of having these discussions because of the fact that the authors here started this book discussion topic at one of our local private schools. And, this was way prior than the pandemic. This was during that time, before pandemic times, and everyone felt somewhat uncomfortable. But now that we're able to bring this into the barbers and beauty salons, it's going to become, something that I can clearly say it will be a turning point, a pivotal point for
Well,
all.
what we want you to do is we want you to share her with us, and let's bring her on the cutting edge.
That
right?
would be fantastic.
What about that? Right?
Wonderful, Mayor Hill.
So we're going to ask you to facilitate that for us, right?
Yes,
right?
absolutely.
So let her know that we want to bring her on the cutting edge. We'll come up with the time and the date and all of that, and we'll frame it around some other people who are talking about the same thing. And let's bring it to the streets, right? Let's put it out. Let's put it out there in the streets. All right. What about that?
Listen, one of the things you said was this pre-pandemic, it was a difficult conversation, more difficult. And now it's a conversation that we can have in advance. Isn't that interesting that the pandemic opened up space for that kind of a conversation? Now, we just shared with you a quote from the CDC director, Dr. Walensky, saying that she has declared in her first few weeks in office, racism and its factors a public health issue. Okay, so what are you hearing in your salon when it comes to public health? Do people even know what it is? Do they see it as something that can help address the racism we're talking about?
That's a good question. I would clearly say to you, I don't think they understand the connection. And it's how it's communicated and the way it's related. And the person that is delivering the message all matters.
You're absolutely right. All right, let's do a couple of things. Let's do this. I'm going to take a break right here, and I'm going to bring up Meg Jordan, our technical director, and let her do her thing with the Public Health Minute. Hey, Meg.
Hi, Meg.
Hey, Mayor Neal. Hey, Ms. Sandra. Okay. This evening on the Public Health Minute, we are actually answering some questions from Ms. Sandra. So, Maggie, are you good to go on slides? Excellent. Okay. So here's where we are. At this point, in the past 2 years, 99.7 million people have gotten COVID. We are close to 100 million cases. In the past, in the pandemic, 1,083,000 Americans have died from COVID-19. 228.8 million Americans have gotten their initial vaccinations, so the one J&J or the 2 Pfizer or Moderna. And then 44 million people have gotten those updated bivalent boosters, as Dr. Osterholm was talking about earlier. Next slide, please, Maggie. Okay, so this is where we are in terms of the COVID levels. At this point, 9% of the country is in that high range where all adults and all people should be putting masks back on in indoor settings. You should be testing before you go and visit people who are at high risk. And you should be tracking and making sure testing more often, especially if you have kids going to school. We have 35% of the country back in the medium range, where people who are at high risk for COVID need to be paying more attention and should be putting their masks back on in closed spaces. Next, please, Maggie. Okay, so let's talk about those questions that Ms. Sander brought. How can you stay healthy for the holidays? And what can you do to help yourself and your family right now? Okay. Ms. Sander asked me what a triple-demic is. This is a lot in the news right now, this phrase that we've decided in public health, triple-demic. So what does that mean? It means that there are 3 diseases right now that are at their worst: the flu, COVID, and RSV. We've talked about RSV. These are all viruses you can get that attack your lungs. These are all diseases you can get through coughing, through talking and air transfer and everything like that. So that's why these are all happening right now at the same time. It's just an unfortunate overlap. So with the triple-demic, why is public health worried about this? Why is public health talking about this? Because with all these things happening at the same time, it's just stress on stress on stress. For you personally, if you have the flu and you have COVID-19 at the same time, it can be really dangerous. Because like we talk about, COVID is just stress on your body. And every new thing that happens to you adds to the stress, right? The other thing we worry about are hospitals getting full. Because we remember in the horrible winters of 2020 and 2021, when hospitals were just full and couldn't take patients anymore. So actually across the country, we track how full are hospitals, both regular beds and ICU beds. Right now, as of today, 80% of hospital beds are full in the US. I was curious what normal is, so I took a look. Interestingly, so normal is around 70%, or the average over the year. So we are a little higher than normal. Next, please, Maggie. Okay. So getting sick, what do? If you feel like you've got a cold, get a test. So you can test for COVID, you can test for flu, and you can test for RSV. All 3 of those tests are typically available at urgent cares. Your doctor might have them, you can talk to them, or you might be able to get tested in ER, depending on what you need. When you start to feel that way, put your mask back on until you know for sure, even at home, everywhere you go. And as we're thinking about the holidays, it's so hard that this is the time of the year when these diseases are at their worst, because we're all trying to get back together right now for the 4 major holidays of the season, right? And so what do we do to keep each other safe? And what do we do to show each other we care? Knowing your status, like Dr. Osterholm was talking about, and being willing to say, you know, if I'm sick, I'm going to stay home. So next, please, Maggie. Miss Dorothy asked me to talk about long haul COVID. Something that's also happening as we get back together is we're having conversations with people we haven't seen in a while. I know that at all the holiday parties I've been to with my family, they've talked about what COVID did to them and what COVID did to their families and the people they know. And this is a good time to talk to your families about long COVID, because it might have been happening to them. They might not know what to look for. So just as a reminder, COVID, long haul, You typically get symptoms that start 4 or more weeks after you've had COVID. You can have new symptoms that you never had when you had COVID originally. And you can have long COVID even if you had no symptoms while you had COVID. Long COVID varies from person to person. And remember, we talked about all the things that COVID can damage. That's what happens. COVID damaged something, and it's going to come out in another way, another symptom. Next, please, Maggie. So as you're talking and you're having these conversations, listen for what they're saying and what you know about them. Think about that. So if they're saying, gosh, I just can't remember things anymore, gosh, and they wander away. If you've got a family member who stops what they're doing in the middle of cooking and just kind of forgets where they are, those are signs to look for. Getting lost, getting confused more often, getting tired faster, just not having the stamina. Or maybe they have headaches all the time. These can all be really common symptoms of long COVID. There can also be chronic pain. So if somebody's got chest pain or stomach pain, lung pain, like because of the scarring in your lungs, people can get asthma-like symptoms afterwards. They can have pounding heart all the time. Just as you're talking to your loved ones, if they start saying things and you start getting concerned, say, hey, that might have been COVID. It might not just be you. Because people of any age can get long COVID and of any health status. You could have been healthy before you got COVID and you can still have long COVID. So that is the Public Health Minute for this week. I hope that you all have a lovely holiday, and I will see you in 2023.
Right, absolutely. Thank you, Meg Jordan, our technical director and the person who does the Public Health Minute for us. And she does an excellent job. And Mike, what we try to do is inform people, man. And so people with practical things that they can use and that will advance their knowledge. We believe in the cutting edge that when you give people the proper information, that they naturally gravitate to take care of themselves. And so what we do is try to constantly give people information, practical stuff, and then have the conversation as well. So that's what this is about. So Dr. T, you need to unmute if you're going to talk.
Hey, I'm gonna say, ain't that something? Hey, Mayor, did she put it where the cows can get it?
That's how you put it where the cows can get it, man. That's important.
Sometimes the information, Big Mike, is so overwhelming that just people can't absorb it. But actionable data presented in a way that people can really translate into, here's what I can do, and then help people do it. So not just any mask, the KN95 mask. Those are the kinds of issues we want to reinforce in the shops. Yeah. And they take home with them.
Yeah. Let me bring up Michelle Lamb. She is up there in Cincinnati, somewhere up in the Cincinnati area. Hey, Cincinnati. What's up?
Hey.
How you doing?
How's everyone doing? My name is Michelle Lamb. I'm the owner of the Hairport Barber and Beauty Studio here in Cincinnati, Ohio. And I just want to say for the last 3 Tuesday evenings, I've been attending a community conversation sponsored by the Urban Lead. And what they focused on was long COVID. And so this is very interesting to me. The knowledge that they gave us on long COVID was, Meg was dead on it. But what people aren't understanding, which I didn't know, and a lot of people there didn't know either, when you get long COVID, here in Cincinnati, they have 2 long COVID clinics, which we didn't know. And also, people with long COVID can file for disability. A lot of people didn't know that. And so these conversations that, where I was at, I mean, they were so informative about long COVID. And just what Meg said, the headaches, the forgetfulness, all of that has to do with long COVID. And this was just spot on it.
No, Michelle, it's like, did we plant somebody in the audience? I mean, it's like a blessing that you come with that kind of validation.
Yes.
And here's the other thing you were just describing. Disability. What did Meg say? It may not just be you. People think there's something's wrong with me.
Mhm.
Getting to a medical home or knowing how to negotiate and navigate the healthcare system, getting people signed up, that's all part of what we need to do as well.
Yes.
Are you hearing that
Yes.
conversation taking place in your shop?
Yes, yes, I'm since I've been attending these community meetings, I'm actually spreading the information to my clients so they can spread it to other people, because this is something that I didn't know. And who would know that they had long COVID, long
Long haul COVID.
you know what I'm saying? Long haul COVID clinics
Right.
here in Cincinnati.
Absolutely.
There's 2. We had no idea. The people there had no idea.
Right.
And another thing I learned is this: during trials, there's only 7% of African American that do trials. Now, what
clinical
I've learned,
trials.
clinical trials. What I've learned is clinical trials are the best care you could get,
That's right.
because they're checking you from head to toe. See,
All
I
the
never
time.
knew that. I get emails all the time, and I'll be like, oh no. But that's another thing that I learned. A clinical trial gives you the best care possible.
Wow. So that's laying some information out, Michelle Lamb. Thank you so much. Everything good up in the Cincy area? You know, y'all not too
Yes.
cold up there, right?
It's
Right.
a little cold. It's
Yeah, I know.
raining. They're expecting snow tomorrow, so we'll see. But
Yeah.
everything is cool.
Yeah.
Thank you, and happy holidays to
Yeah,
everyone.
much
And we
love.
have to stay safe,
Right.
because the numbers are up here in Cincinnati.
Yeah.
The
All right.
hospitals are full here in Cincinnati.
Right.
Yeah.
Trust your eyes. Trust
We
your
need to
eyes.
do that. One thing, Big Mike, that a lot of people were, talking, everybody doesn't die from COVID, but they don't talk about long haul COVID and how it can impair you for a long period of time as well. And I think we need to talk more about long haul COVID to the community as well. So you may survive COVID in terms of not dying, but it can have a negative adverse impact on your health.
Mayor, there was a study that just came out this past week that's found that probably 300,000 people have actually died from long COVID here in the United States, meaning
Wow.
that it's not just acute, but it's also long COVID. So you're right, you don't want to get long COVID. At the
Right.
same time, I think it's really important that people understand that the drug treatment, particularly the Paxlovid, if you can have access to that, has also been shown to reduce long COVID by 30 to 40% if you take it when you're clinically ill. So these are the kinds of things that we can do to help people, one, avoid developing long COVID, and then 2, I think Michelle said it really well, we have got to find the kind of clinical studies and support to understand what is happening with long COVID. It's not just one issue, it's a number of different organs in your body. What is it that we can do to treat that? Otherwise, it's just a tale that's going to last forever.
Yeah. Real talk. Michelle Lamb,
Yes.
thank you so much for laying that out. That's very helpful to us. Merry Christmas to you, and
Thank
happy
you.
Hanukkah, and
Yes.
happy
yes.
Kwanzaa, and every other. We certainly appreciate it.
And
All right.
thanks
All right.
for spreading the
Let-
good words.
Absolutely good. Let's go to Pine Bluff, Arkansas. And see, we got to go to Pine Bluff, Arkansas. It's not what's that other place? I don't even know the other place now.
Don't get messed up with
Little
Rock.
Rock. Yeah, but this is Pine Bluff. We're going to Dorothy Reynolds. Hey, Dorothy, how you doing?
Hi, how are you all tonight?
Wonderful.
I'm doing fine. My voice is a little distorted, so I got my volume up.
Okay.
But we just completed an essay contest at the high school cosmetology program.
Wow.
and the topic was how COVID-19 affects the cosmetology industry.
Interesting.
And we had a first place, second place, and third place winner. The city, which is one of our partners, and the hair store where I buy products from were our sponsors to provide gifts for these kids. And the one that had first place got a $50 Visa gift card, a $30 for the second place, and the third place winner got a $25 gift card. And our salon and the hair store gave everybody, all 9 people, there were 9 participants. So everybody got a gift, a Christmas gift from us.
Wow.
That's wonderful. So there's no losers in dealing with you all, right?
No, you're gonna
that's
win one way or the other.
That's good. You
But
know,
the
go
young
ahead.
lady, the young lady that won first place said that she started not to even participate. And at the last minute, she decided to submit her essay. And it was the best one. I mean, it was really heart feeling and well thought out. And she did her research. And she cried after she won because she said, Miss Reynolds, I didn't know I was getting anything. But she said, you just don't know how you have blessed me today.
Good.
And
Wow.
we were so happy about that.
Well, thank you
But
so much. Go ahead.
What I would like to say regarding racism in the salons, if you think about it, churches and salons are next to churches. Salons and barbershops are the most segregated places you can find because we call them black barbershops, black beauty salons. And when you go in the store to look for the products, they're sectioned off. The products for the white barbershop or beauty salon and the products for the black beauty shops and salons. Now you'll have some people that will, go to both, but for the most part, you have black salons and that's where black people go. And so, of course, in certain neighborhoods and certain situations, you can break that barrier. But for the most part, that's what you're gonna find.
So what do you
And
hear?
not only that, funeral too. Same thing. We got to figure out to make this a more perfect union, and I don't know quite how to do that. Obviously, we need to talk to each other, and that's what that we have authentic conversations about the issue of race. It was Neely Fuller that said, "If you don't understand racism, then anything else you think you understand will only serve to confuse you." And so it's important it's important to understand what we're talking about. Dorothy Reynolds in Pine Bluff, Arkansas.
Thank you, Dorothy,
it's so
for all
good
you
for
do.
Dorothy. You do so much, and obviously this is the end of the years, but we thank you for all you do. You always have something that you're doing to engage the community, and we really thank you, and all of you do. But I wanted to really make that point. Thank you very much.
These are
All
those
right.
acts of kindness, Big Mike.
Absolutely. That's
going on out
that's
there.
Random acts of kindness. That's
There you
a
go.
great thing. Let me go down to ATL, to Atlanta, Georgia. We proud of Georgia. Georgia. In fact, I think Senator Warnock won. I don't know if he won since we had our last show or what. I don't even know. But anyway,
I didn't vote for him. I don't know if he won or not. So that's
oh Lord.
Like you've been under a
Oh,
rock.
we can't do politics when you talk to Andre. So
okay, yeah, okay. Whatever you say, Andre. Good. Hey, man, how you doing?
I'm good. How are you guys doing today?
Fabulous.
I had a
Wonderful,
young
son.
man on. I had something that I was going to say, but as far as our wellness efforts go, we were talking about how to get them into some of the barber schools. And I had a young man, he stuck on for just a minute, but he had to go. And he has a school and he's spread out nationally. And I'm trying to get him to institute, on top of all of the other things that they're doing, sanitation wise, to talk about wellness and the COVID things in this school. And he was going to talk about it, but it took a long time to get to us. However, he's committed to doing this, and I'm going to introduce him along the way, because apart from what we're doing, if we have new barbers coming in with the attitudes and some of the clarity that we have, I think that's going to be a good thing. And he's the first digital school that we have across America, and he's doing fine. And I was hoping that he hung around, but we didn't.
Yeah, I saw him. I was going to bring him on.
Yeah.
But we'll get him on at another point in time.
Yeah, that's good. That's good.
Andre owns.
Merry Christmas and happy holidays to everybody.
Absolutely. He owns a barbershop in the airport.
Yeah.
At the Atlanta airport, the busiest airport in the world. And so his barbershop is in the airport. So
there you go.
So we're real proud of him and what he does there. Andre, for all you do. You know, let me say a couple of things. And maybe Dr. T, you were saying something.
Yeah, I'm trying to
go ahead.
I say they just took Andre down. But I wanted to give a shout out to Andre and some of the other warriors who've come up because they actually came into the classroom. And I want Big Mike to see how we integrate our community engagement with the actual teaching program. So Andre was in the class where the students did their final presentations. And Andre, I just want to thank you for your engagement with them, that next generation. They were so pleased to have your input.
I was very happy to be there. Thank you for the invitation. And I did want to say this. I also said it while we were there. When I was in school, we did not have green things going on outside. We didn't have all these things where you walk around and not have a class. If I had had a professor like you, I think I would probably be president. I just don't know.
Thanks, Andre. I appreciate you. Hey, you know, there was a question, and I don't know if anybody can answer this, but I'm going to throw it out to you, Mike. If once you get a long haul COVID, is that permanent, or can you recover from that? That's the question that came.
Yeah.
forth.
Well, no, clearly we have had individuals who have fit into what was described as a long haul COVID picture who over time do recover. What we don't know, though, is just if you look at each of the different types of long haul, whether it appears to be neurologic, it appears to be in your blood, it appears to be in your lungs, the fatigue factor, they're all different, yet they have overlapping causes, obviously. And so one of the challenges we're going to have is understanding what's the prognosis of this, or this. It's like cancer. Some cancers, the prognosis is very, very dire right at the time of diagnosis. Other cancers, if you catch it early, hey, you're going to live another 30 years. And so we're trying to kind of figure that out for long COVID, and we don't know. But as I pointed out, we do know that long COVID itself can lead to a fatal outcome. And so this is an area we need much, much more research in. And unfortunately, as we talk about health disparities, one of the areas that has traditionally been underserved are the communities who, again, the communities of color who would have had long COVID. What are they accessing? What are they getting to?
Right.
And so I think this is a huge challenge.
So if you think you have long COVID, you should go to your doctor just as if you think you have COVID, right? Is that correct?
Exactly. Well, absolutely. And as it was stated earlier, there is actually some availability of disability support for people with long COVID. And so you don't want to miss out on that. And, one of the challenges of having long COVID, if you can't work, is the economic implications are huge. Mm-hmm. Well, if you can get some help with that, that will ease the burden a bit of what's going on with long COVID. So yes, definitely you need to be seen.
Right. Thank you so much. We have just 12 minutes left. Can you imagine this? So I guess the question
always 12 minutes.
is where do we go from here?
And what's race got to do with it, right?
Yeah. What do we do? What can we do practically? Because we talked about studies and all of that. Yeah, that's fine. Okay. As a person who has engaged in public policy implementation as the mayor of a city, how do you come mayors, Mike, about what we can do as city leaders, municipal leaders, right? Talk to me from that perspective.
Well, I think one of the things that mayors bring to the table that many of us don't understand is if you're the mayor of a city, a disaster can happen in an hour, but change sometimes occurs over years.
Wow.
And so I think that what you're constantly doing is trying to hold off disaster and being very clear that if it happens, you got to respond like that now, but change over time. And what I think really what I get from this experience here is you give me hope and energy to keep doing it because it's going to take time. And I think we don't do enough to rejuvenate ourselves. We're talking about everyone else's problems and how to help them. And those are important. Don't minimize it, but we need to help ourselves. And I think that frankly, Mayor, if I could bother you and Dr. T and Dynamite, I could sell that for a pretty good price on Amazon. And I think that that's part of what we need right now is that long term. And when you're a mayor and you're thinking about waters and sewers and, all infrastructure, you don't think about fixing it overnight. You got to have a plan. You got to, and I think that's really a very, very important part. Finally, the last piece, when I said earlier about the pulpit issue, you don't want person on one part. I'll take that back for an exception. We want leaders. And I think that what we need to do today is identify the fact that there are those people that can inspire. There are those people that can share information. There are those people who can be the reason why I believe we can do something about this. And you know what I'm doing? I'm going to shake it up big this next semester at the University of Minnesota. Guess who I have coming for a guest lecture to my class? The infamous Dr. T. He's coming, man.
And he's giving me time to do it.
Oh, a lot of time. And you know what? My goal for him is shake it up, man. Tell it like it is. And
he said, bring it.
Yeah, I did. And I'm in it. So anyway, I'll report back to you afterwards what it was like. I'm sure it'll be interesting. Okay.
Hey, Dr. T, try and record it.
Oh, it will be recorded for sure. Listen, I have a mayor. I have a leading epidemiologist. So let's talk right now, just for a moment, about what's race have to do with it. How important is it, Mayor, for you to have the data presented in ways that break it out by race and ethnicity? And for my epidemiologists, there's some evidence that some of the information and publications that highlighted disparities in minority communities made whites less sympathetic.
Yep.
And so here, okay, just take a moment about how we present the data, how important it is to make policy decisions, and does race matter?
Yeah. Well, we talk about it oftentimes, Dr. T. How you frame the issue determines who embraced the cause.
Okay.
Right. And so it's so important for us to frame the issue properly. And that is through data, through information, things that we can quantify. And then we also have to be, Mike, you just hit on all of the salient points. We have to be honest with people. We have to tell people what we don't know. Right. And I think that kind of authenticity is what resonate with people, where they can trust you. Right. We don't know, as mayors, we don't know everything. We have to rely on people like Mike and Dr. T and others. We have to rely on you all to tell us, and then we frame it in a way in public policy. But then we have to sell it to our constituency. We have to sell it to the people. Right. If I understand it and can synthesize it in a way that I can make it plain to people with sincerity, then people are more likely to accept it.
So you want that data broken down by race? Huh? You want that data broken down by race?
Yes.
Well, we understand race disparities and how those things impact us. I think that's important. At the same time, we can't just say that we got health disparities and don't deal with the things that create the disparities.
Okay.
And I think it's important that we not just acknowledge the fact that it exists,
Right.
but actually do something that is substantive enough to have a sustainable, transformational, movement to change those things, not only for now, but for our posterity.
That's right. Well,
Right.
Big Mike, you may remember early in the pandemic, we didn't have the data being broken down by race.
Yep.
And we fought for that. But this pushback, I would hope that it would not be cold water on presenting the data as it is, telling it like it is, and letting
Right.
people act on it.
Let me say something that, I hadn't thought about in a way of sharing with the group, and I surely feel like I'm in a safe space. But you know what? I love this man. I do. We've had a most amazing relationship. I've learned so much from him. You know what? I don't love this man because he's black. I don't want him to love me because I'm white. I want him to love us because we are who we are. Now, once that happens, then we can look at each other and say, hey, you know what? That's not fair what's happening there with you. I'm in on the fight, okay? Because you'd be in on the fight if we're on my side.
That's right.
And I think that's how we have to look at this, is that, why do we get involved? Why do we do what we do? And, I'd walk over broken glass forever for this guy barefoot because I love it.
Right.
Then the rest falls into place.
And imagine in the battle of trying to save lives, we haven't met in person.
Yeah, we haven't yet. Yeah.
Right.
And all of the network that you've now been brought into.
Yeah.
And it's like, if the troops are coming in, what you do to give us that data guidance. You see, I'm Harriet Tubman. We got to help our people along the way.
Yeah.
Get them to freedom.
Mm-hmm.
But just so you know, we haven't met in person. I'm convinced, though, in my dreams, I have swept the barbershop of Dynamite. I've swept that floor. I know that.
Let me say this. Maybe Dr. T. Let me kind of school my brother here. We are spirits having a human experience, not humans having a spiritual experience.
Yes.
Always known each other.
Yes.
Right. That's how it is, and it's always. I mean, to have you with us, Mike, it is so special, man. Every time you come.
Well, I have to tell you, I realized something tonight, Mayor. I think you and I are related, and I'll tell you why. I'll tell you why, because I heard you refer to Dr. T as your twin brother of a different mother.
Right.
Well, he and I came to that conclusion months and months ago that we're twin brothers of different mothers. So I guess
we all related.
I guess we're all related, man. We're all related.
I
love it. You're absolutely right, man. That's so good. Go ahead, Dr. T.
I was just saying. I said that when I was in the shop, and even at the White House, I commented in the workshop. There are a few places where I've just seen Black men just fall out belly laugh. And Dynamite, I'm telling the truth. And we've created that atmosphere right here in this virtual space.
Mm-hmm.
And I just think that's a wonderful thing, because I've been in a whole lot of Zooms on these topics, and there are very few smiles, even among our friends.
Mm-hmm.
So we have to create a space where that kind of creativity that Andre was able to see in the students comes out, because we want them to join us.
Mm-hmm.
And now's the time to make that a conscious choice for public health.
Yes.
Well, let me say this, Dr. T. We got 2 minutes, and that's how they say time is when you're having fun. But let me say to our wellness warriors, thank you all so much for everything you do, both seen and unseen. You all are incredible. These are our barbers and our stylists that spread out throughout the country. What you do for your clients and what you do for your community is immeasurable. There is no way to quantify it. So thank you. To our team, Dr. Cooper, and to everybody else who's part of our team, here for our team behind the scene, Soraya, Meg and Maggie and Elijah. Thank you all so much for all that you do to make The Cutting Edge a successful show. And to Dr. T, the person who is the visionary behind this whole thing that we're dealing with. And it's so important that we give people their flowers, while they yet live. I was always told that, right? Because so they can smell them. Thank you, man, for convening us so that we can have these special moments that we can try to do the information that will be helpful to people and that can live through it. Lastly, I want to thank our special brother from another mother. Big Mike.
Big Mike.
Dr. Michael Osterholm. Let's give him some snaps.
Come on, Big Mike.
Mike.
Welcome back, buddy.
Love
Big
him so
Mike.
much, man.
Thank you.
Thank you
Thank
so
you.
much.
I'm
for coming.
so honored to be here. Thank you. It's
Thank
my
you
honor.
so much. Season's greetings to everybody. This is the last show for the year. We'll catch you on the next year, and we'll have the same kind of thing going on and on and on and on. Again, thank you for joining with us on this segment of The Cutting Edge. As always, I'd like to leave you with these 2 words. Remember that I love you with a perfect love. But more importantly, remember this. You got the power. Until the next time on The Cutting Edge, have a wonderful Christmas, Hanukkah, and everything else, Kwanzaa, everything that you're experiencing. Have a wonderful day. Have a wonderful new year, and we'll see you next year.
Bye-bye.